Hello friends, I am Dr. Srikant Jawalkar. I am a senior neurophysician in Care Group of Hospitals. Today I am going to talk to you about a very serious illness which is very common in India. It is called stroke. That is, stroke happens because there is a reduction in the blood supply to the brain, and this generally strikes after the age of 55 or 60, but here in India we are getting strokes even in younger patients. When that stroke develops, generally what happens is there is weakness of one half of the body, either right hand, right leg, or left hand, left leg, and there may also be difficulty in speaking, or the patient may not be able to speak. There can be loss of consciousness, and sometimes vision is also affected. So this is a very serious and debilitating disease, and particularly if it happens in younger persons, it causes a lot of difficulty to the family. The finances suffer, the person is not able to work properly. Hence it is very important to treat stroke in time and also take measures to prevent the stroke. So I'll talk about how you can prevent stroke. The risk factors for stroke are diabetes, high blood pressure, obese persons are likely to get it more often, and smoking. So out of these two, smoking and weight reduction is in your hands only. You can don't smoke or stop smoking, regular exercise to reduce the weight, and if you suffer from high blood pressure or diabetes, you must regularly consult your doctor and keep both these diseases under control. So if these factors are taken care of, your chances of developing a stroke become very less. Similarly, if suppose you develop a stroke, somebody develops a stroke, the treatment, there are various modes of treatment for these strokes, and particularly in the immediate phase after the stroke, in the first few hours, we have got very good medicines, what is called as thrombolysis. Injection is given into the veins of the patients, and there are very good chances of recovering from the paralysis if you reach the hospital in time. So my request is that if you feel that any numbness or weakness in one hand or one leg or one half of the body, or if you find difficulty in speaking, or if there is headache or vomiting, don't waste your time. You reach immediately your nearest doctor or hospital so that proper care can be taken. There are now very good imaging techniques like MRI and CT scan to detect the stroke in very early stages, and if the treatment is started in good time, the chances of recovery are very well. The person can become fully functional. There are methods to prevent the stroke also, medicines like aspirin and clopidogrel. So those who are at risk, like high blood pressure or diabetes, or who develop early stroke, can be put on these medicines to prevent future problems. There is one condition what is called as TIA, transient ischemic attacks. Here the person may suffer for a very temporary, for a few seconds or few minutes, symptoms of stroke. They recover immediately, but you should not ignore it. You should go to the doctor so that you can be put on preventive treatment. That's all for the time being. Thank you very much.